Hello, everybody, and welcome to our second episode of Parkimpulse, where we explore the complexities of managing the different neuropsychiatric conditions in Parkinson's disease. My name is Bettina Rotzetter, and I'm joined here today with Dr. Ines Debove. As you'll recall, in our first episode, we met with Professor Daniel Weintraub, where we spoke about Parkinson's and the importance of actually involving a psychiatrist in the treatment. And in this episode, Dr. Ines Debove will continue her conversation with him to discover the key differences between a psychiatrist and a neurologist. But before we met with Professor Weintraub, we also had a conversation with Professor K. Redfield Jamison from Johns Hopkins to discuss the parallels between neuropsychiatric fluctuations in Parkinson's and bipolar disorder, which we will later on feature in an episode. Jamison is a world-renowned American clinical psychologist and author whose work has focused on bipolar disorder. So the comparison was really interesting for us. But as we start the conversation today, Ines will talk to Professor Weintraub by understanding the difference between preventing bipolar disorder, where adherence to the medication really is the key, and managing impulse control disorder, which is often medication-induced and requires careful dose reduction. As we shift our focus, we'll examine how the distinct skills of a psychiatrist and neurologist play a vital role in making challenging decisions, especially in difficult psychological situations, carefully weighing risks and benefits for optimal patient outcome is really crucial.
It was interesting because when we were talking to Jamison, she said, in bipolar disease, there is a prevention. You take the medication, you do your cognitive behavioral therapy, but actually you have to touch somehow rock bottom to go back to the point to really wanting to treat it. That was something, and I thought, okay, this is the difference because we can really prevent the patients coming to the point of getting ICD.
Yes. Yeah, that's another good point that it's occurred to me in the past, but not until you just mentioned this now, is that I think another difference with bipolar disorder and what we're talking about, and this is where I struggle, I think, with a neurologist more than any other place, is that as psychiatrists, we're used to having to set firm limits with patients. We're used to doing things that a patient may not like, or taking control of a situation, or trying to take control of a situation and not deferring to the patient. It's just the nature of psychiatry, because we're used to people having maybe not being truthful with us, or violating limits that we feel like we need to set. I think neurologists by nature, in a good way, just want to be helpful to the patient. If a patient reports any neurological symptom, a tremor, stiffness, slowness, their inclination is to just increase the medication or add a medication because they think that may be helpful. And I've talked to neurologists before where this problem exists, let's say an impulse control disorder, and the neurologist will say, well, there's just nothing I can do about it. The patient says they need this medication. And I said, well, no, you're the one who's ultimately responsible for prescribing it. And it's your job, in my mind, to weigh the risk and benefits of the medication. And if the risks are such that it's outweighing the benefit, it's not like the right of the patient to be on this medication. It's your decision, and you have to do what you think is in the best interest of the patient overall. And so sometimes I feel like that comes easier to a psychiatrist based on our background, where we're used to dealing with very difficult situations and very difficult patients, than it comes to a neurologist in some ways.
Thank you so much for joining us for this in-depth exploration between psychiatrists and neurologists. While neurologists often focus on immediate symptom relief, psychiatrists are trained to navigate these complex psychological conditions. They set firm boundaries and carefully weigh the risks and benefits of treatments, especially when a patient's judgment is impaired. Understanding these distinct roles can significantly impact treatment outcomes. Mastering this art of balancing the risk and benefits is crucial when managing complex conditions like impulse control disorder in Parkinson's. Stay tuned and stay curious. Our next episode will take you even further into navigating these challenging neuropsychological conditions to ensure the best possible care.